Welcome to the Massage Therapy Podcast. I'm Heather.
And I'm Nicole. We are RMTs, female small business owners, and colleagues with more than 13 years of experience. Join us each episode as we sit down and discuss the latest in massage therapy, share experiences, and talk to other practitioners in the healthcare world.
Grab a cup of tea, put up your feet, and enjoy the episode. Welcome back, everybody, to today's episode. Hi, Nicole. How are you doing?
I'm good. How are you, Heather?
Good. So much has happened since we've last recorded.
So much. Which is why it's been a little while, because we've been busy.
Yeah. So since we all last spoke, we've been given our go ahead to go back. That was probably 2.5 weeks ago, 3 weeks almost ago.
Something like that.
Yeah. I think 3 weeks at the end of this week.
Yeah.
And we've gotten our practice guidelines and everything. And today we just wanted to sit down and talk a little bit, maybe like Nicole kind of mentioned off mic, a little opinion piece, just what we're doing in our clinic. Again, we know that not everybody has the same clinic setup as us, but if maybe the way we see things and the way that we're approaching some of the guidelines may be helpful to others. One thing I wanted to kind of touch on, just to, again, we're not professionals in this in any way.
No.
We are professional RMTs. I am coordinator with our area with the RMTAO. So I have sat in a few meetings regarding going over practice guidelines, some webinars on that. I also sat in a meeting talking with some suppliers and some information that's going to come down the pipeline with that. As well, I have been a health and safety rep and have done the 2-3 day training with previous jobs, and have when we were talking about this, that we've basically both been a part of the joint health and safety or health and safety rep in almost all of our jobs. So I think that means that we have a pretty solid background to understanding where some of these guidelines come from and what's the driving force to them. So we just, again, we're not say it any way that we are the professionals on this.
We're not doing it the only way.
Yes. No, there's so many ways to do this, and it's up to you, and you're the professional for your clinic and your clients. But we've also seen and had a lot of conversations and heard a lot of conversations of some things that kind of fell on our radar as to questioning some people's decision. Some concerning
maybe
confusion.
Topics. Maybe it's confusion. All a little red flaggy though, even since it's so new back and it seems to be already so confusing, where I think we kind of felt a lot of it was pretty black and white on what we had to do, and then it was up to us how we implemented it, right? So and as you had mentioned, we both were on health and safety, which is kind of a weird fact that we both learned about each other through all this. And with you being our germ region rep for the RMTAO, and for me having some experience sitting on some CMTO committees in the past, including quality assurance, I think the two of us combined kind of are able to reason out what they mean by certain things and what they don't mean, or how what they mean will fit into a lot of different scenarios. So maybe this will give some light to some RMTs, and any non-RMTs that are listening, maybe some clients or potential clients that are listening, maybe will give them understanding as to why your RMT hasn't opened back up yet, or why, if your RMT has opened back up, why they're doing certain things and it seems like you can't get in, or if it feels like they're being a little much. It's because we're being told to do this, and we're trying to keep ourselves safe and you safe. So plus we have all of our governing body and Ministry of Health on top of us telling us what's really important. So we're waving through it all. I'm sure things will change and happen as we all go through it, and we kind of figure out what is easier, what works better. We just kind of wanted to have, I think, a candid conversation about it, because we've had many conversations. We thought maybe some people would like to just listen to two RMTs or rant about it.
I kept having moments where I'd feel you know what, this isn't relative. Going through and making our protocol book and putting everything up and putting our signs up and all this. I'm no, it's been a while now that we've had this. RMTs nobody needs to listen to us ramble about this. And then
everyone gets it.
I would see a post, or I would hear of a conversation, or someone would reach out, and I'm like, maybe this is a little bit relevant. This is relevant to have this conversation. There still seems to be more confusion out there.
Yeah, we're lucky to have each other to bounce things off of. We also have other RMTs that outside of the two of us who work and we can bounce things off of. So we have a nice little network around us where if we've been confused, or what do you think this means, or did you see this? And we've kind of been able to talk about it, whereas not every RMT has that. Some RMTs don't really have another RMT. So we're not saying anything we've come across is necessarily like bad questions. There are no dumb questions out there, but we've learned some concerning things where it's like, that was very black and white. CMTO, Ministry of Health, was very clear on that. Like, I'm not sure why this is a discussion. Like, the answer is pretty clear, right? So,
and we'll say too that, you know, how the whole process went, and we've heard this word so many times, but this is, you know, unprecedented times. Everybody's just kind of doing the best that they can, including the CMTO, including the RMTAO, including the government.
Yes.
You know, we're all just kind of scrambling at this point. When we got the like draft of the practice guidelines, I think a few of us, and myself included, thought, okay, these are guidelines. They're not going to change too much. There might be a little bit of change. I heard some other RMTs say that, like, you know, if we have questions and we can kind of push back and at least say as like a collective, these are concerns we have about this particular guidance piece, there could be changes made. But it kind of seemed like we got it. And then a week later, it was, we woke up one morning and the government said, okay, go back to work starting today. And then we all went, what?
And then there were some technical difficulties and the CMTO had posted it on their blog that we could go back, but none of us had officially gotten any emails. It was like a few hours.
So we all flooded
and
the
then
blog,
it crashed.
And then it crashed the website.
Yeah, the website crashed. And then I had clients emailing me and texting me being like, I heard you can open. I'm like, I actually don't have any official word on that.
Yeah.
But like, I think that's what's happening. It was like 4:30 at night. I think we all got an email from the CMTO saying like, nope, what you saw and read is true. We'll get back to you. And we're like, okay, that's great. So it really was dumped upon us right from the get-go. And it was a lot dumped on us after they finally did email us, between all of the online learning and like just what you need in PPE. Again, like you had said, because we had given the draft, we sort of felt like that was probably how it was going to go. So we sort of started a while back looking for and getting information on masks and gloves and hand sanitizer and Lysol and stuff like that. So I think you and I kind of just used our professional, like, better judgment and was like, if this is what they're using in places like medical offices and stuff like that, it's probably going to be good enough for us. So we kind of, you know, bit the bullet and spent the money. I think we both bought cloth masks, unsure if we'd be able to use them or not. And we're not allowed to use cloth mask now, but
we can have them at home.
Yes. And that was my thing. I'm like, if I can't, I use them at home. I've given them to family members and stuff like that. So they weren't a waste. Just in case we can, we'd rather have them. It's an expense, but places like Costco, you have to wear a mask now anyway. So it was good to have them. So I think we kind of had a bit of a jump on the gun of that.
And how many times, you know, parents, I'm sure during this time, how can we help? How can we help? And so I just kept giving them the task of, if you see Lysol wipes or spray bottle, just grab it and I'll reimburse you. And because I have such a large family, that trickled out to aunts. And if you're listening, aunt, thank you very much.
Thank you so much.
A message. That was incredibly sweet of you. We both appreciate it. But
we do. Thank you so much.
Yeah, we had I want to kind of back up to February, when we all started hearing about this breakout happening. You and I had a conversation. We had already been going through the flu season, doing some of the protocols that are set out in here, because you said, like, I've done this every year and I've never gotten sick. So like, this is what I do. And I just said, okay, yep, that sounds all logical. Plus then when this started coming in, we heard about it in Wuhan and it started to grow outside of the Wuhan territory. You had mentioned that you had previously gone through and practiced through SARS, and these were still the protocols that you did. And the ones that I'm specifically talking to was, you wore a mask. You would well, we all sanitize the room after every
Yeah.
client anyways, but then we did additional chair that they might've sat in the waiting room or in the clinic room where they put their clothes, the table beside the chair that they might put their keys and wallet on, all doorknobs, light switches, and the desk at least twice a day.
Yeah.
We did that. We did that around lunchtime, all the extras, the high traffic areas, and the desk and everything at least twice a day. And especially one of those being at the end of the day. We were already implementing a lot of the stuff that was already here.
Yeah, just like one thing. It was actually H1N1. It wasn't SARS.
Sorry.
That's okay.
Sorry.
That's okay. They all happened within our lifetime, oddly enough.
Yeah.
But yeah, it was H1N1. It was my first year out. It was my first cold and flu season out, and I was living in northern British Columbia, and it hit there early because their flu season starts early. And it was at a naturopathic clinic. So yeah, we were doing the mask thing. We were asking people, because she's a naturopath and a chiropractor. So we're asking people if they were sick to stay home. But I can tell you, like, every day I had people in my office who had someone at home who had H1N1, or what they were presuming to be a case of H1N1. So because at that point they didn't even have enough testing, and they weren't really testing. It wasn't as severe as this. So people just got really, really flu symptomy sick. So it was kind of crazy. We started doing lots of like naturopathic like teas and elderberry and stuff to help our immune system, but I worked every day through it. So I think I was lucky enough to have gone through that so early in my career that it really made at least a cold and flu season, or when things like that happen, how important it is to stay on top of it. And I like to point out to like some friends and family how in our office before this all happened, so it would have been September, I went over with you, like, here's what I do, here's Lysol that I work. I usually use hand sanitizer before I touch the doorknob on my way out, just so I'm not touching every doorknob on the way out to the bathroom with the hands that I touch someone with. And I was like, and I Lysol all the things, and you took verbatim for that. And you wrote a sticky note, and it's still in the office, and you have it on the desk, and it says Lysol all the things. And I think it makes me laugh when I see it, just because when we got all the new protocols for cleaning, I realized, although they are a bump up from what we were doing, they're not really outrageously more than what we were doing. I mean, cleaning the whole clinic, top to bottom, side to side, twice a day is more than I was doing. I was absolutely doing that in the treatment room every time, but I wasn't necessarily wiping down like my printer in between every person. Like I wasn't doing that kind of thing every single, like twice a day. Like that's a lot, I think, a lot of RMTs, but high touch surfaces all the time, right? Like we're already doing it. So I think this really kind of made a lot of us sort of stop and think, like, what are we doing and what needs to be sort of improved, right? Because I feel like we were taught all of this in school, right? And quite honestly, I think I've said this over and over again, like COVID-19 or being influenza or anything else, HIV, tuberculosis, you never know what's coming into your office. So you always really need to be like aware that somebody might have something, or know that even if someone doesn't know they have something like influenza, they come in, and then the next person might have someone at home who is immunocompromised, because that's come up a ton. Because it's not just necessarily the person on your table, it's their family at home too, right? So I think this has really given us the ability to like reflect on the practices we're using and have a better sense of like what we need to sort of keep the standard at. And I personally don't think any of these standards are going anywhere anytime soon. Like I know a lot of RMTs are hoping that they'll be lessened or as time goes, you know what I mean? And I don't think they will be. I think this is going to be our new normal. Maybe not the masks all the time. You know what I mean? Like they might make that if some restrictions lessened on that, but I think this will be an absolute like new set standard for us. So I think everyone needs to sort of like accept what we're doing and kind of just figure out how to make it work for them. So
yeah, there, like, again, like we've said so many times, if there's a will, there's a way, and it does affect, like there is a lot of cleaning, and it's not going to go anywhere soon, at least not before, like you said, before a vaccine comes or anything. So this could be it for the next 6 to 12 months, if not longer. Do I think it's going to stay at this heightened level for the rest of our careers? I don't think so. But some stuff will be here to stay. One of the biggest things that we're hearing is that a big concern is that we're having to increase the time between clients.
Yes.
And we've kind of touched on this in a previous podcast. I believe it was with Kathy that, you know, having 30 minutes in between clients, most RMTs had 15 before. That was kind of the standard, and increasing that to 30 minutes isn't necessarily a horrible thing, other than it does reduce the amount of people you can see in a day, which then does reduce your income and your finances overall. I completely understand that, but maybe that's where you have to look at what you're charging. Maybe you should increase what you're charging. And I know we all don't want to do that because we want to make sure that we're accessible to clients. Don't sell yourself short. You have skills. You now have all of these new protocols you have to do to ensure your client's safety. You have all this new PPE and sanitizing and disinfecting that you're providing to keep the client safe. So, you know, you are worth it. You are worth that fee increase. If it means that you can stay in business and help those clients, because if you can't afford that at the price you were doing when you were seeing 6 clients a day, then none of those clients have an RMT anymore.
Exactly. You have to get out of it.
Yeah, you might lose a few. That's true. But if you want to better serve them, you have to make sure that you're bringing in money to be able to do that.
Absolutely. And clients will understand. The ones who get it and the ones that you will want to have around will understand, and they'll feel safe about it. I had a lot of clients trying to book in because I start on the 23rd. So I start next week. And quite honestly, like I'm now booking into mid-August because I'm booking like that much time in between and longer lunch breaks, because doing work from home with a toddler is absolutely out of the question. So sending it pre-screening emails and all of that, I just have to take a longer lunch break and all of that too. So when I tell clients, you know, like, I know you need this time, I have a half an hour, and they go, is that it? And it's like, that's it. Like, this is what I have. And you're going to have to understand, like, you know, like I'm trying to do my best to keep everyone safe, and I'm only one person, right? And they like the environment they have. They like that it's just them and me in the clinic. That makes them feel safer. But when you have that, it also means I don't have any support staff. I don't have anyone sending out those emails or making those phone calls or cleaning that room while I'm in another room. Like, we have one treatment room. So they have to understand that to get the service that they're coming in for, they're going to have to give up something, whether it be length of treatment time because I'm not available, whether it be they have to wait longer, or it be that they're going to have to pay more. I think you and I had talked about, I don't think we've initially decided not to raise our fees for now. But it wasn't because part of it was because we wanted to make sure people could still, you know, afford the service. But I think the biggest part is we want to figure out how much it's costing us to run our business now. I didn't want to just put up a fee increase without sort of knowing the numbers and then realize that the mask plus the time, because your time is worth it. Your time is something, plus the Lysol, the cost of hand sanitizer. When I add all those things in, it actually should be a $5 an hour increase. So I think we both were just like, you know what, we're going to keep it right now. But if it doesn't work, like if we get into this and we're like 2 months in and it's like, this is really financially a burden on us to have to keep it this way, we'll make that decision. It will be hard, but I think you explain it to clients and you give them the like straight and narrow of it, and then it's up to them, right? Yeah. So a lot of clients do use their insurance and they like to go as far as it can, but if that's what it costs, that's what it costs, right? So I can see other services are going to be going up. Like I can imagine places like hair salons, right? Like nail salons. I'm sure like your average whatever at the dentist, like they're going to start charging insurance companies more money, like all of those things, right? Like we're not the only ones. We're not the only paramedical service or healthcare service or service in general that's going to be charging more because of all of this. You go to the grocery store and things are 40 to 60% more already, just because the cost of like getting it here costs that much more, right? Because we can't get it as readily, or they're having to air freight it over as opposed to a boat, which is cheaper. So it is what it is, but I know that weighs heavy on a lot of RMTs, like you had said. So that's what we're doing in terms of fees.
Yeah, for sure. And I do think because, we're both in a unique situation where it's we're not working off a commission. So I'm trying to think of, how that does affect somebody working off of a commission. you know, I would think that the clinic would be kind of buying out of their portion a lot of the PPE for the clinic. But if the RNT is working in an office, but like they're kind of left on their own to also get this, maybe it may be worth, it's always worth asking if you need to negotiate your percentage or talking to them about putting a cap on it for now. I know that might be hard because the clinic owner is also probably hurting because not as much traffic is coming through. They're having to stagger appointments and things like that. So I get it, but at the worst, they're going to say no. And then you decide what your next move is. Do you stay and you work at that? Or do you maybe go a different avenue, or you stay there? Plus you open up, if you have the ability, in your own home and take on some friends of friends or some other clients as a supplement to the other, depending on how many days of work. I'm not saying work 7 days a week. Please don't do that, unless you are a superhero and can do that. But there are, again, there's so many other options. Like Nicole mentioned in a previous podcast too, is that like when her first clinic she worked in, she also did have some home clients too. Like she worked both of them just to get her hands on the number of bodies, right?
Absolutely. So we're kind of starting from the ground up with all of this, I think, you know, like I think we're all really reevaluating that kind of thing. So it should be pretty like exciting to see how it all falls out. I think the massage therapy community as a whole kind of rallies together. I've been really noticing like a lot of RMTs starting to like support each other, because I think we kind of had an issue with that for a while. We were all kind of on top of each other. So that's not what we're trying to do here. We're just trying to show like what we're doing, the reasoning for not raising our fees in this particular part. But that doesn't mean we won't. I've seen RMTs who are raising them, and I'm like all for that. Like there's no problem. Also, because I'm going off in November, I had this sort of piece to me where I felt like raising them just for the next 4 months for me personally, like would have been like a lot, but I understand Heather's going to be there all the way to December. Right. So, that was for me part of the reason I didn't raise them either, but that doesn't mean I won't. I've had a few clients, and some like friends mentioned to me that although it seems very noble, they expect me to be raising them. They're just like, you know, I think it's noble of you to not right now, but I do expect you to raise them. Like it can't be feasible for you to continue to do all the things that you're doing and not. So I think people get it.
That's also a tribute to how we've set up our practices.
Yes.
And how to make it work.
Clients get it. They know it's not just like $1 per minute type of service that they're getting from us. It's like a whole thing, right? Like from the time they walk in to the time they leave, the amount of time, dedication, extra they're getting from us, the passion we put through our work. They understand that it's not just this 30, 45, 60, whatever, how many minutes are on the table. They understand all the background work because we personally email them back. We personally answer their question. Yeah, like personally texting numbers back. So they get it, that it's more like that. So and we're happy to do it. That's why we are in this position, because I like that personal direct contact with all of my patients, but they trust, right? They trust us, and they understand like we're totally forthcoming and transparent with all of it, right? So I think that's important. And it gets harder the bigger I think a clinic you're in, because I worked in lots of big clinics. I could see how this would be difficult to navigate, because you're not the only one making the decision. But I think everyone just has to have open, honest conversation with each other to be like, hey, like this isn't working, or this is, or you know what I mean? There's going to be a lot of contract negotiations, I think, going on for a lot of people going here on it, which is good. I think that's long overdue. So
no, I definitely agree. Let's pivot to somewhere where I think we are where we will actually be different, I think, in our responses. We've both also seen a lot of people posting and getting hung up on the accepting clients and prioritizing them.
Yeah.
This word of prioritizing,
essential clients.
Clients. I'm trying to, you're supposed to prioritize them to make sure that you're just triaging. That's all you're doing. It's just like when you go to the ER and you see that nurse, you're prioritized indicates when you get to see the doctor next. It's just the way that our universal healthcare system works. So again, we're saying we're part of this healthcare system. Therefore, we need to use this as well. So I don't think our approach to this is different, but because our client base
is different
in numbers.
Yeah.
You know, you're 11 years in, I'm a year back. So those look very different. To be honest, you know, Nicole's booking out till August. I'm booking out. I'm only 3 weeks out right now from right now, which is pretty good.
Yeah, that's absolutely very good.
But I'm also going to be honest that, you know, my days aren't packed because we have to, you know, I want to get used to the mask. I want to get used to with the mask. So I limited myself. And do I want to be back? Do I want to see and help all of my clients and get them all into 1 or 2 weeks? Yeah, I do. But I need to look out for them and I need to look out for myself. So for me, whoever's contacted me, to be honest, all the people that contacted me were kind of mentally the ones that were going to be at the top of the priority list anyways.
Absolutely.
So it's just been easy for me. My schedule was 98% clear.
Yeah.
I had a few people have booked in and so I was able to work around them, but I don't know. I'm sure it's been a different roller coaster for you with that.
It has. So because actually I was looking because I still know what days are. So today's the 16th. So tomorrow marks 11 years since I got my registration.
Oh my gosh.
Congratulations. Exciting. Yeah. So 11 years. Because of that, I do have a lot of clients that book monthly. They have a schedule. I put most of them are in their maintenance schedule. I've been in that quite a while. But so what I sort of approached it as, because I have clients who book their whole year out and then we change it as they need. So what I did is a lot of clients who book the whole year out, they do it because they know they need that once every 2, 3, 6, 9 weeks to stay healthy. Yeah. So because we've all been off for 3 months, what I've done is anyone who already had a pre-booked appointment, because I shut down my online booking a while ago. Yeah. So no one new had booked in. But anyone who had a pre-booked appointment, I've done my best to keep them. I have had to shorten a few, and to a few clients who I haven't contacted yet because their appointments are a few weeks out, I will still be having to shorten a few from, say, an hour to 45 minutes or an hour and a half to 75. Like, I'm still going to have to manage that to get enough time between clients. But I've tried to honor the people who have taken the time to know like what their body needs and book it out over the year. So I felt that they were prioritized already because they knew what they needed and they booked it. And then I've had a few people who aren't ready to come back or still feel like they're okay. So they've canceled a few. And then I've sort of booked in the clients who haven't been able to be in that need in and put them in and give them time slots where I can here and there. I've found that a lot of people are still working from home, so they're pretty flexible. Yeah. So that's been really good. So that's awesome. I've also found that a lot of clients who are like, I really need in, when I'm like, hey, like, how does end of July sound? Which technically is only a month from when I go back. So it's not that long. It seems longer because I haven't opened yet. Like, it's really like 6 weeks since they told me, but like, how does this sound? They say, you know what, I think I can last that much. You know what I mean? Like, and I've given them home care. So like, I can handle that. I've also put a cancellation list in place for anybody who doesn't pass our pre-screening COVID, or they decide, you know what, like, I'm just not ready. Like I thought I would, but I went out and I'm just like not feeling it. So I do have a list of people who I've booked in who, if something comes up sooner, I can bring them in sooner. But that's sort of how I prioritize the essential people, because I already did have people booked out and I didn't think it was fair to any of them to cancel their appointment because they've already missed 3 in a row, kind of idea, right? So that's how I went about it. I don't think I don't think it was wrong. I mean, again, we were never deemed an emergency service to begin with. So I didn't feel bad in that. I got a lot of people though, because summers are generally a little slower.
Yeah.
So a lot of people I find book their year from January to June. Then July and August, they wait and see how they feel and how their holidays are going to fall out. And then they come back and they book September to December. So I think that a lot of clients will understand like why I've decided to keep people pre-booked in their time slots, and why I only have the time slots I have, and why I don't have like an hour like I used to, and I can't fit people in last second. I think clients will understand that. I've had most clients so far totally understand. And when I tell them straight, like, give me the days, the times, the hours are available. And then when I get back to them being like, I have this day for 30 minutes, this day at this time for 45, and this day at this time, like pick what you want. They all seem to understand, and nobody's been too picky on the fact that, well, I want an hour. I only want an hour. It's like, well, then if you want an hour, it was hard for people to get in for an hour after 5 o'clock to begin with. So, you want that hour, like you're gonna be waiting a while. And if you're willing to wait, then you're probably not an essential priority. Like you're probably not hurting so bad, right?
Mm-hmm.
So that's also kind of the way I've been able to filter it. If people are able and willing to take what I got, then they need it, right? So I think the prioritizing the essential sort of triage thing sort of filtered itself. I had a lot of clients who over the course of the last few months have kept in contact with me, so I kind of knew who they were. And being that I've been in this so long, out on my own in this clinic now for 3 years, I just know the clients pretty well too.
Yeah.
I will say this, I have decided, unless a new client had already booked in, I'm not taking new clients.
That was something I was gonna kind of touch on too, was even though I'm only a year in, and some people might think this is controversial of me, but I have also decided not to take any new clients. That also has a big asterisk on it, unless they are a referral from Nicole, or they do contact me, that they would be kind of maybe one of those priority people that I'm like, okay, like you've tried to get into so many people and you can fit into my schedule. That is just like a whole other, I think that's just a whole other exception.
But you're not just taking anyone and anyone at any time.
Unfortunately, not right now. Just a few months entering the busy season. Nicole is going to be going on mat leave. I'm going to be increasing my hours, and she will be letting her clients know that they are welcome to come see me. It's their choice or not. I know there's another RMT that Nicole's worked with in the past that they might go see her too, or go see somebody else entirely. That's okay. But I want to make sure that they know that they are a priority to me while you are on mat leave. So that is the other part of that. And that's also because of how Nicole and I run our businesses. They're parallel to each other. They don't overlap in clients. So even if we have a crossover in clients, they both have to fill out a health history with her and a health history with me. So I just want to keep that open for them, because it's easy for them to just keep coming back to the same place. We already know that we share some clients because they tell us that they've seen the other person and tell us their experience. And they've said that they feel that we treat the same. We kind of are the same energies that we bring and all of that. So that is my reasoning. And I wanted to put that out there because, some people might say, well, you're only a year in, like, how could you not take clients? Like, what, you don't like money or anything like that? You don't want to help people. That's not what it's about. It's just, this is our unique situation, and how, if anybody was in my position, but maybe in a different clinic, that might not be their decision. And that's fine. It comes down to assess what's going on in your clinic, your practice, and make the decision that's best for you and your clients. Just like in all the IPAC videos that we had to watch, assess your personal risk, quote unquote. Assess your personal and decide. And that could change for me in a month from now. That's fine.
Right.
Just like right now, I'm limiting my appointments at 60 minutes. It's been only like, I haven't even started yet. That's going to loosen up, I'm sure, in a few weeks or a month. but right now it's at 60 minutes. I have the ability to do that. So I'm exercising my ability to do that.
Exactly. And clients will understand. And I'll say the reason I'm not taking new clients is simply so that I can prioritize everyone I have canceled in the last 3 months.
Yes.
Because I do get quite a lot of traffic through my website. And I did that little interview there on Global News Durham.
I never asked how many people contacted you after seeing that.
So what's really funny is like Fraser Snowden, the reporter who contacted me, he kind of sent me a funny text and was just like, you might get a few phone calls, LOL. And I was like, bad? Like, was this before I saw it? I'm like, what does this mean? It's funny, the clip they had used, I had mentioned like, do you take new clients? That's a judgment call. So it's funny that now this is sort of where I'm at, because I wasn't sure at that point if I was, and I'm not taking new clients just right now until I have figured out that all my previous clients are taken care of. That's the only reason. I know some RMTs are not taking new clients just because you don't know their background history. You don't have trust with them. And I mentioned that in the interview, like you don't know their history. So like, I totally understand that. And that's the piece, I guess, kind of there. But for me personally, it's 100% because I want my clients to be looked after, the ones I've already established a relationship with. So that's a big consideration for a lot of RMTs. But you could be a brand new RMT who graduated during all of this mess, and you're starting a brand new. You have no other choice than to take new people, and there's nothing wrong with that. Nope. So I think a lot of RMTs maybe have to like rethink that, because I see a lot of RMTs saying like, you can't, like, why would you take new people? Like, how can you? And it's like, that's not what it's about. Like, you can assess the risk of a brand new patient, I think, no problem. You just have to be, I think, extra sort of diligent, and use that like professional judgment that you have, and that you've sort of learned, and know where to go with it. So that will probably be something I loosen up after the summer. But the thing is, I am going off at the end of October. So like, do I really start a new client on a new treatment plan just to leave them? I don't know. Maybe I do. Maybe for just people who are kind of come in for a one-off here and there, or I start them on it and say, hey, straight up, you can tell I'm pregnant. You can already tell I'm pregnant. So like, I'm going off at the end of October. If you'd like to continue the treatment plan at this clinic, you can now see Heather, right? Because she's here. So I'm sure that'll loosen up, because I get a ton. I'm getting like tons of emails and phone calls from people. I'm not sure if it's 100% directly related to the interview.
Oh my gosh.
I haven't done advertising, or I haven't done anything in months. And so they're finding me somehow. And I think it has to do with that a little bit, which kind of made me laugh a teeny bit, because it was kind of a weird moment to have that interview dropped on.
Oh yeah, that was such a, out of nowhere. Do you want to talk about it a little bit?
Yeah, sure.
Like how it happened?
Yeah, I think he just Googled like RMT Durham, and my name may have come up on Google, because it wasn't specific to me. So it wasn't like I'm anyone special by any means. But I got a phone call, and it went to voicemail. And then I got a text, and it was like, hi, my name is Fraser Snowden. I work for Global News Durham. I was wondering if I would talk to you about how massage therapists are able to go back to work, and what your feeling on that is. And this was like, I think the day after. And I was like, oh God, I don't even know. I haven't even read all the things or done any stuff. Like, I don't know how I feel about it. And I wasn't going to do it. I think the first person I texted or even told was you, because my husband was working. I'm like, oh my God, I don't know what to do with this. And you're like, what are you going to do? I'm like, I don't know. And then I talked with my husband, and he was all excited about it. He's like, do it.
Do
like,
it.
what if it's like a piece and they make me look dumb or something? And he's like, you should just still do it. It's free advertising. And I'm like, oh God.
The true advertiser.
Yeah, exactly. So I was like, fine. So he called me we did a Zoom interview. We talked for probably 15 minutes. They used 8 seconds of the 15 minutes. But I think the 8 seconds they used was like a decent one. When I've listened to it, it makes me laugh just because it sounds very dramatic. The news anchor says, Nicole Andrews, a massage therapy clinic owner in Oshawa. And I'm like, that's very formal. Makes me sound a lot bigger than I am. And then it just says that the new going back to work will be an adjustment. And it just sounds so like very, I don't know. It made me laugh quite quite a few times.
Well, if you want to go and take a listen, you can over on our Facebook page, the Massage Therapy Podcast. I think we put it up there. You can take a look, or over on our Instagram too, the .mtp, and see Nicole. That was on Global News Durham.
Yeah, it was pretty fun. It was fun. But I will say with that, after getting that, I realized how big it was going to be for the public to figure out like what we were doing. So although I hadn't had any time to really digest that we were going back yet, it kind of hit me in the face that, all right, like we've been told we got to go back. You have some big decisions. You have some big decisions to make, like how you want to go about this. So, because it was thrown on us. So it was like, all right. So I made some RMTs went back like that next week. I chose to take 3 weeks to go back. Some RMTs are taking longer, and I don't think there's anything wrong with any of those choices. I think it's a very personal choice. What we do is very close and hands-on and very different. We've said this many a time than any other healthcare practitioner. So to try to parallel it to what physios or chiros are doing, or even doctors, it doesn't really compare to what they do. Like it's just a different ball game, sort of like our environment. So like
and our client risks are all different between all of those as well, right?
And we have such varied places of work. Like most chiros kind of work in the same place, most doctors sort of work in the same environment. Physios are, you know what I mean? They all are similar, whereas RMTs sort of seem to be all over the map. Like I don't know many chiros or physios that work out of their house. I don't know many that do mobile or in-home calls. Like that's not a thing. So we have I think that sort of added to the confusion with some RMTs. Like, how do I apply this to the fact that I go to people's houses and I'm not cleaning their house when I show up, right? So a lot of RMTs had to really like look at what the protocols were and directives that we got, and sort of again figure out how they fit and how you can accommodate them into your new practice. And I've been really impressed by a lot of the RMTs who are doing house calls, because I still do some. And that was something I was really like, I don't really know like how I'm going to fit this in, but watching how they're doing it, how they're bringing in just the sheets they need. And when they leave, they put them in a plastic bag and they're separate from anything new, and how they're wiping down everything in the house before they leave, like all of that. I've been really impressed by how RMTs are, using Ziploc bags to keep things separate, and like really trying to figure out like how they can implement all of the protocols. And I think it's been like really, really good. So
the home mobile and people that have their clinics in their home is where I really can empathize that they're limiting no new patients. We're at a clinic and we're bringing whatever home. They're in the space that their family lives. That's completely different. And so I can understand, again, from that point of view, people if they're not taking on any new patients right now, because like you said, they can't trust it, or, they don't have that rapport or whatnot with those clients. So even before COVID, I know it was, typically by referral, people who worked mostly out of their homes. So RMTs are so creative, and they're so innovative with how a lot of the home care. We have somebody in our group that shared a lot of her home care protocols, and like what she came up with. You're just like,
wow,
you thought be in your brain for 5 minutes. I would love to.
Yeah, absolutely. Right. So it's good. It's been really good. And that just, I think it's to attest to that protocols and directives we've given aren't impossible to achieve. Maybe we should talk about what those actually are, for anyone who's not an RMT and doesn't know what we're talking about. So we have to wear a surgical mask, surgical level 1 3-ply mask. For every person. They have to not be cloth and reusable. They have to be disposable, and we have to change it after every client if we can. So if the PPE is there, and or when it is visibly soiled or wet. So at that point, they're not effective. So I've seen some RMTs, I think, trying to take some liberty in that if available portion to it. I caution RMTs, just whenever you're thinking about why you're doing something, when you're taking into account like cost and all of those, take into account the risks that you're taking. I understand that nurses spend full shifts on floor with the same mask and all of those things, but just take into consideration, like, is it a big burden to have to change it after every person? Like, what is the burden you're really taking on in that situation? So before we start like blurring the lines of the legalese talk, this is what they expect. They want you in a perfect world to change it after every person. Is it really unreasonable or like unattainable to do so for at least a little while? I think that's something that will lessen. But I think right now they've taken information from the Ministry of Health and their panel. CMTO has a whole panel, probably a whole task force now that's dealing with this. And with the best knowledge they have, this is what they've decided. And I trust their judgment on that one, at least. So yeah, we have to do the mask.
Well, I wanted to speak to that. Just the masks there. I've talked to a lot of people in the medical field, and I told them we have to change after every client, and they said, no, you don't. No, I understand you don't have to based on the based on the criteria of that mask. But our governing body has instructed us that we have to do so. Do I personally agree with it? No. But do I understand how they got to that reasoning? Yes. Am I going to abide by it? Yes, I am. Because to me, the risk of not abiding by it and then somebody contracting COVID, that's number one. I don't want that to happen. But then from there, if they contract it and it can be traced back to the clinic, now there is going to be an investigation. There will be. And if I'm found that I was not abiding by these guidelines and specifically the mask, I'm going to be open to so much legal issue and I will lose my registration and therefore lose my job and my income. So to me,
over a mask,
I'm just going to change it.
It is what it is. And it's a cost, but not a huge cost right now. And yes, it's a lot of garbage.
That does weigh on me.
But it's sort of like do with the best knowledge we have. And I think that will be one as it comes, that it won't. I think that will be something that they lessen, and that it's not with every client. It starts to be like with your judgment. If you feel this person has come into or is higher risk of coming into contact with COVID or anything else, then you wear a mask and you ask them, you know what I mean? Like I can see how they're going to slowly reduce that one. But I have absolutely no problem wearing it. It's an upper respiratory tract disease. So yes, I understand out there's lots of misinformation, or not maybe misinformation, lots of contradictory information, whether or not masks actually help. But I will say this, when I go into my medical doctor's office, like I did today, and she is wearing a mask, I trust that she is doing it, and she's in less contact with me than I am with my clients. You know what I mean? Like she literally is taking my blood pressure and sitting in a chair and talking to me 6 feet away, and she's wearing a medical mask. I don't know if they're changing it every person, but she's wearing one. It makes sense to me. It just is like, that's just what they're doing. I should be doing the same, right? So yeah, I know. I think it'll change. Other provinces, it's different. They can wear cloth masks. I think just the CMTO understands that they can't regulate that at all.
Yeah.
Right.
It's easier to say a level 1 mask.
Yeah.
And it does say in here, a level 1 mask is the like kind of the minimum that is required. However, they want you to stick to that level 1 because the higher levels, like your N95s, because supply is low right now and the demand is so high, hospitals need that right now. So if you happen to have a KN95 or an N95, you ended up buying a box and you're like, oh, I can't use them. Go educate yourself on the level of masks. Those masks are higher than a level 1.
So you can
use them. It's just they're trying to keep us from buying supply that's like needed for the hospital, because there's some procedures in the hospital that they cannot use a surgical or procedure mask, and N95 is required, like in the ICU with COVID patients. Like we need to save the supply
for them still.
And
I think that's why the CMPO actually put in that "and if available," because it could come to a point where it gets really hard to find surgical masks, right? I think a lot of people are already finding they're delayed, they're hard to get. So in the event that you bought 2 boxes, say you have 100 of them, right? And it says that it's going to be 6 weeks for your next shipment, and you're going to go through those 100 faster than, let's just say, 6 weeks. Then they're giving you the ability to keep your doors open, right? So do what you can, maybe just wear it for 2 people. Do you know what I mean? Like, they're giving us the professional judgment to make that call. But what I don't want to see, and I kind of seeing it out there, is RMTs that are like trying to live in that gray zone just because they could. And
that's a risky position to take.
Let's have some higher standards in that first off. Let's not like, if you're finding that it's too expensive, then you maybe need to raise your fees, right? Like right from the get-go to cover it. Like that's okay. You can do that. There's nothing wrong with that. So that's one of them. I think that's one of the bigger ones. That, and
I was just gonna say, I just feel like that living in that gray zone, and this might be a bold statement for me to say, is that, you know, you're pushing that boundary of non-healthcare provider and not using your professional healthcare provider judgment. But when we were labeled as non-essential, there was such an uproar about us not being healthcare. Why is the government not seeing us on that level? But then are trying to find loopholes to wear masks. We're upset that, you know, we have to triage patients and cut time with clients and extend time in between clients. Like, if we want to be seen as healthcare professionals, we have to entirely be seen as healthcare professionals and act accordingly. So use your therapeutic, your professional judgment with that. And I do believe that line, like you're saying, where it's saying if available, means don't just use it and then when you're out and you keep practicing. Like, if you're keep an eye on your numbers of masks and your clients, and when your supplies coming in and the clients that are coming in. And if you need to double up between 2 patients, if it's a husband wife coming in, and maybe I'll use the same mask for them and then change it for the next person when your supply is low. Again, use your therapeutic, and just like the IPAC says, your environmental risk, your personal risk, like assess those things every single client.
Absolutely. And it's not clear cut. And I think the CMTO did a pretty good job of knowing that it's not clear cut. And that's why a lot of the sort of things seem to have like a gray zone. Although, saying that, I still feel like it's pretty clear what they want from us. The only gray zone is where they surround it, how you're implementing it. They told us exactly what they want us to do, but it's how we implement it that is being given up to us, because it is such a varied work environment for all of us. So when they say things like clean your workplace twice a day minimum, if you are a solely mobile therapist, that does not exist, other than maybe you're cleaning your car twice a day minimum, you're wiping it down. That's kind of, I think, the parameters that they gave us.
Absolutely. Yeah, like you and I, we can probably do twice a day, but a bigger clinic that might have 3 or 4 RMTs at the same time, 2, 3, 4 RMTs at the same time. And even though they're staggering patients, they might have to clean those high traffic areas again after every client, or 4 times a day, or whatever it is.
Exactly. Right. So you got to take into account like your judgment. So don't just go by the minimum standards. Don't let any of the, like, I'll say it's propaganda, but all that stuff out there, like cloud that judgment. You know what I mean? Like, keep it really clear cut. I think another one that people are confused on is when they have to do the before appointment screening. What did it say in the CM2? I think they gave like a 24-hour type of like timeline, but it's more so whenever before. I don't think it doesn't have to be 24 hours before.
It could be before that. It could be at the time that they make the appointment.
It could be a week before. It could be like because they do expect that we can still take same day patients. At no point did they not say that. So it could be on the phone when they make the appointment that morning, and then you still have to screen them when they walk in that night. It seems kind of redundant, but that's sort of the standard they've set. And I'll say my views on the reason they've done this, and I don't know if anyone has really talked about it out there, but because I think a lot of RNTs feel like it doesn't make sense to do it twice. The entire reason I'm 100% sure the entire reason for this is so that you do not have someone showing up and then screening them at the door and realizing they should not be there.
Yeah.
Because you're already now at risk.
Yeah.
The whole point is to keep these people at home if they have any sort of issue. So, I mean, my doctor's appointment today with my doctor, they did not call me to pre-screen me. But when you show up to the clinic, they screen you on the sidewalk. Right. And a nurse stands behind plexiglass 6 feet away from you. And you use hand sanitizer before you even get into the place. So they have the ability to screen you before you even walk in. And then before I walk up 3 flights of stairs. So it's different. Whereas if you walk into if you booked the appointment, say yesterday, you come in today and you walk through my doors, you have your mask on, and then I go through it and I realize this isn't good. You're already standing in my clinic. You're already standing in front of me. So even though we might be 6 feet apart and you're both wearing masks, that risk is already there. So they're trying to limit that completely. So when RMTs sort of feel like it's redundant, it's a lot of admin work, all of that, that's the entire reason. And it's logical and it makes sense. I would rather know and have someone cancel. It also allows you to limit the like last minute cancellation policy. Yeah. Right. Which I think a lot of people are concerned about. Like, how do you deal with that? Like if I send out an email 72 hours in advance saying, do this pre-screening, someone gets it and they look at it and they go, maybe I'm not sure about going in. They can tell you, and then you can fill the spot. Right. Or they do it and they look at it and be like, you know what? I'm not feeling 100%. I should cancel. So it's not a bad thing to have. It's really not a bad thing to have to do the screening twice. And the reason you have to do it when they show up immediately is because literally anything can change in half an hour. So
goes back to, your professional judgment as to like, they didn't say, they kind of had like a minimum, like before their appointment or just before their appointment. I'm trying to look for it now in our little book here. But again, it's depends on how long in advance. If they booked this appointment a month in advance, you're not going to send it to them a month beforehand. But if they booked an appointment today for an appointment tomorrow, you're going to send it to them now. Like, so again, use your professional judgment with that, because it could be, again, somebody who has come in during, their first appointment post-COVID, they've had their appointment, great. They're booking their appointment for 4 to 6 weeks out from now. You're not sending them the screening now.
No, you're sending it to them maybe 70 days before, maybe a week before. Do you know what I mean? Just because that whole, like, have you been out of the country in the last 2 weeks? Do you know what I mean? Like, it can take 2 weeks for symptoms to show up. So probably the 2 week out in advance is probably the limit you want to do that. In my opinion, like, I think professional judgment, like if someone booked today for a month from now, I wouldn't bother doing it. But it wouldn't make any difference. If there's that 4 week window, it makes no difference, right? I expected that screening, and I think that's not too hard to implement. We do have the technology on our side. We do use a software, right? Which I think a lot of RNTs we had that side conversation at one point, I think earlier today. If you don't have a administrative like assistant or a receptionist or anything like that, it can do your thing. Like it took us no time at all. Together we made up a template for the COVID 24-hour screening, and you just put it in the agreements, and we just have where they either have to just check a box or they check and sign it, and they submit it back. That's not that difficult for me to sit down I think how I'm going to implement it, because I work Tuesday, Wednesday, Thursdays. So on Thursday afternoon and Thursday after work is when I'm going to send out the following week. So it's no more than 7 days in advance, right? For some, it's a little less if you're on the Tuesday, that kind of thing. And it's really easy. I just go in and I can just click on the person I'm seeing, go into agreements and email it off to them. I think the hardest part is going to be tracking people down for this. It's much easier to give a phone call and get them on the phone and do it, because you get them right there. So I think tracking them down is going to be difficult, but I've decided I'm not tracking people down.
If they don't send it, like we've said, we don't get it by 7 p.m.
the
day before your appointment, it will automatically be canceled. I'm not even going to try to call you. It'll just be canceled.
You know what I mean? And we put that in, so we have a whole protocols handbook. How many pages is it now? Like 7? 9. Oh my God. Okay. So we decided to go like the hardcore full out written route. I think because both of us are just a little OCD and like to really cross our T's and
we're very
I's.
procedure driven.
Yes. So we like to know what to expect, how to expect it, if we had to duplicate it for anyone else, we're like, here's you go, right? And just so we're on the same page, so when people come in, they know they're getting the exact, like, similar, same page care. So oh my God, that was a lot. My brain hurt on top of the iPad videos, writing that up. Yeah, it was a lot. But I think that's why we feel so prepared. And when it comes down to like us looking at the guidelines and where some people are struggling, we aren't, because we sat down and we went through every single directive that they sent us and wrote out exactly how we are putting it into our practice.
I think that's a testament to our background in health and safety. Committees,
yes,
because
that's what you do.
Yeah,
we did
basically used the guidelines as our policy, like our clinic policies are the guidelines. And then it's procedure on how we will complete and fulfill these guidelines. So to give you an idea too, I don't think we've ever mentioned this, but we do not have a washroom or a hand washing sink in our clinic. It's down the hall behind a locked door. Only businesses in the building have keys to the door. And there's a limited number of clients coming through this building for all businesses anyway right now. So we literally walked through how before and after a client we are going to walk from our office to the bathroom and back with barriers for the doors in this process, and then not on the way back, but things like that. We walked through that exact entire process
and then wrote it down.
Wrote it down. And we also did a mock-up. We met one day, we had our book with us and we did an exchange and we walked through it just like we were back in school doing OSCE preps. I think that is really important. And honestly, if you're going to look at it then from a legal side, if we were ever audited or investigated, we have I have the book sitting in front of me right now that we have everything in here. So it's kind of hard to say that we aren't abiding by these.
No, we took the time to walk through every step, figure it out, write it down, put it on paper, print it out. Right. So it'd be hard pressed for someone to say like, you're not following it if you went through all the effort of actually doing that. Right.
And we have this available for our clients if they want to look at it.
Yeah. We put it in like a plastic binder with like slips that you put paper in. So if anybody wants it, we can hand it to them. They can in person read it or look through it, and then we can wipe it down, because we thought that far ahead. Like we were like, if somebody wanted to look at this, if they were unsure, if maybe they're not tech savvy, they got an email, but they're like, I like that in my hand tangible thing, we could give it to them. Right. So that felt really good to us. I'm so glad that we did like the walkthrough. We are also telling our clients, just so you know, on your way out, we're encouraging you to keep the paper towel that you use to finish drying your hands, to open the door of the bathroom and use that because it's only that door and then our clinic door, and our clinic door will be open. So they won't have any other doorknobs to touch, but that's the only doorknob we have no control over. Right. So here's how you mitigate the risk. Use a barrier. Right.
And we have hand sanitizer in the clinic so that
when they walk back in, they like, oh, I forgot I touched the doorknob on my way out. It's like, all right, so now you just use hand sanitizer and come right on in. Like, so we've kind of eliminated that, which is different from another clinic who has control over their bathroom.
So
just being prepared. So like to RMTs haven't come back, like do like a mock run through. You know what I mean? Like get a family member or a friend. Or another RMT, you know what I mean? Anyone that, like to like be like, hey, you don't even have to give them a massage. Just be like, I'd like to run through this for you. Like,
because that's the other thing that we're doing is we're also, because so many other businesses are in our hallway, we're going to have the door to our clinic kind of partially closed or closed. So letting our clients know, the door will be closed, but just come on in and there'll be hand sanitizer there, because we're also going to be, once we've redressed the room for them, we're going to be closing the treatment room door.
So we know no one's gone back in and touched anything.
Exactly. And then also if that person then comes into our clinic in by 2 steps and did the verbal screening and they couldn't pass the screening, they immediately leave. But if that door was closed and nobody,
we know that it wasn't the integrity of the room isn't contaminated at all. So that's like a little thing too. Like maybe you shut your treatment room door I routinely leave it open because I like the light from the window, but that's not happening anymore. And I fixed the light in the reception area today after like, I don't even know how many embarrassing months it was, it was broken. But anyways, it's good now. So yeah, like those types of things. So yeah, we have to wear a mask. We have to have our clients wear a mask. We've decided that if clients come in and they don't have a mask, we're charging them for the mask, because we feel that at this point, either clients should be having a mask to go out in public, because that seems to be like the way we go about it, or you understand that you don't have to wear a mask anywhere else, but I'm not covering the fee for your mask. My regulatory college has decided that you have to have one, and it is too onerous on me to make sure that every client also has a mask.
We can't absorb that cost as well.
No. So. And because clients can wear cloth masks, it saves the garbage. So instead of putting the onus on us to make sure that we have disposable masks for them, because we don't have the use of cloth masks for us, I was actually happy that CMTO said that, because I had already decided I wanted clients to wear masks because I'm pregnant. So it was already a barrier that I wanted people to have. So I like that CMTO did that. And I understand why they did that.
Well, I wanted to mention with the mask wearing, because some people, and we've heard, read a few RMTs have like kind of gone back who already and talking about, which is great, the clients wearing a mask, prone face down in the face cradle. They've had some people have issues and some others not have issues. And they did, like you said, they kind of gave us a little bit of like a gray zone with like, if people, for breathing reasons or whatnot, if they can't, it's up to the therapist's discretion if they would like to, how they want to deal with that. So that there's so many ways, it could be that they just pull it down and have their nose exposed in prone in the face cradle. That then is, you are assessing that as a practitioner. If the benefits outweigh the risk of that treatment with that specific client, and one client may be different from another client, that's fine. They can just wear it. They can just choose, if they don't feel like they can be face down with the mask on, they might be claustrophobic, whatnot, and you don't feel the benefit outweighs the risk, then maybe they need to postpone their appointment. But I'm also going to throw out a fourth option. Remember sidelining? It's not just for pregnant people.
No, exactly.
Sidelining is great for everyone.
Or even just their head turned off to the side. You know what I mean? Like I have a few clients who get a little claustrophobic with their face down. So how about I just, you know what I mean? I say, hey, we'll slide you down a bit. I'll give you a pillow. You can be with your arm. You know what I mean? I mean, it's not the best position for their neck and their shoulder, but like we make modifications. Anyway. Yeah, exactly. So it's like, all right, if you don't feel comfortable with your face down with the mask on, then and you still feel they really should be wearing a mask at all times, and not pulling it down, then have them just turn their head off to the side and have the mask on. Think outside the box. That's it. You know what I mean? Like, and I don't mean that in terms of like how you can get around the rule, but think outside the box and like how you can implement them. Like not one size fits all, in every single person, every single scenario. So yeah, I don't know. I don't think any of the things we've gotten are incredibly outrageous.
And if we want to be seen as healthcare professionals on that level, then with stuff like this, we need to start exercising our therapeutic judgment and our healthcare judgment, and not kind of throwing caution into the wind.
Not grime about every like little thing. I feel there's like this constantly this like war with RMTs. 1 minute we're like upset that we're not looked at as healthcare practitioners and as regulated health professionals, and we feel like the CMTO govern us too closely. And then the next minute we're all crying about how the CMTO is being unclear. You know what I mean? Like I will say, from someone who's sat on CMTO committees, there's nothing more frustrating than being like, you're supposed to have the knowledge to understand like how to work this out. CMTO is not there to babysit us. That's not their job. Their job is to look out for the public and to make sure that RMTs are acting accordingly so we don't hurt anyone in the public. And I'll throw this out there. A part of all of that is how RMTs are perceived by the public and other healthcare professionals.
And the media.
and the media, do not think for one second that the CMTO, when they are looking at new directive, when they're looking at new policies, when they're looking at case precedents, that they are not thinking, how will other healthcare professionals out there, the public, the media, how will they perceive this? That is something that they care about, because if at any point any of those chains start perceiving us as not worthy, they can take the right of self-governing from us. It's not something we just get to have. We have to earn it. And being able to self-govern and regulate ourselves is a huge task. And I think RMTs need to understand that that although we have a large membership, right, it is different for us than other colleges. We are in a very unique situation, and it is different. And they, like, I haven't always agreed with them on lots of things. I still think some policies they have could probably be worked out better, but I can see why they've done it the way, because they've tried to make it as easy and as forthcoming as they can and keep it straightforward, which in this world is not an easy thing to do. And this was thrown on them too. Don't think anybody at the CMTO is an expert in like pandemic protocol. Like, that's not a thing. So they're all doing the best they can, and know that they have public members. Know that there are public members on the council, and they have input too. So there are people who are out in the public who get massages, and they are telling the CMTO, as a public member, as someone who would be just a client who does not know anything about massage therapy in that sense, this is how I feel. And that weighs heavy on them. They take those opinions very seriously, and they do take the opinions of their like elected council members seriously. And if you have an issue with something, instead of just like, you know what I mean, like, make your voice heard. Like, there's nothing wrong with that. I think I would like to give props to the RMTAO right now, because they have been listening and they have really had our back recently. And one big thing is when they had that press conference with the premier and Christine Elliott, and when asked why can you get a massage, not a haircut, and Ford looked straight in the camera and said, I don't know. Like, that's a problem. And the RMTO stepped up, and they very much did their due diligence and wrote a letter and tried to educate the people in power as to like what the right answer should have been there.
Because we are,
right, you know what I mean,
professionals. And I think a distinction need to be made.
So not that I feel that hair like salons and things like that aren't regulated. Like, there's nothing, it's not that I think they're any less than us. That has nothing to do with any of it. And I think that's where people were getting hung up, like the public couldn't understand, because in just straight terms of like risk assessment, it didn't make any sense. But what they didn't realize is hairstylists, barbers, they're all a trade, but we're governed differently. They don't have, as far as I know, anyone walking into a salon being like, you're not using barbicide correctly, so you can get your entire license taken away from you. Like, that's not something they do, right?
No, they do.
Do they?
The trades. I wanted to point that out, because my hairstylist is great, and she sent out all of what she's doing, and she's implementing. I don't know if this has come down from her trades governing body, or if she's implemented it, because she's not doing anything different than what we're doing.
Yeah, exactly.
She's doing everything the same as us. So I don't think it was fair I think the question was fair, but I don't feel like how it blew up was fair, because it all of a sudden pitted us against them. Hairdressers, and that like it's us or them. It's not fair. But we're different. Like, we shouldn't be compared in any way. I think it comes down to, I think what a lot of the upset with that was, with the response, was that we weren't seen as part of the healthcare industry.
We're being lumped in with the service, right?
Service industry, yes.
So, and what I wanted to say on top of that, but I think one of the big things too was that when the government was looking at what was reopening and when, they took the risk assessment, and CMTO had been the RMTO had been lobbying the government and working with them and telling them, like, although we're not emergency, we do have, like, not having our clients being seen does put strain on our healthcare system, right? So I think that's sort of where it might have been decided from what I've been reading and seeing, is that they were like, so they're regulated health profession, not that getting your hair cut isn't important, right? It doesn't put the same strain on society, in at least healthcare. Because when you look at the hierarchy of like services and things, healthcare is like, it's up there, right? Like, it's one of the things you have to keep going. So I think that's sort of like where they sort of drew the line. But again, they didn't tell us we had to reopen. They said that we could, right? And there's lots of RMPs that didn't.
And like you're saying, is that like, so this whole pandemic that's happening is putting a stress on our healthcare system.
Yes.
And if you're going to pit us against hairdressers, yes, we have the ability to make a greater impact than hairdressers, because I'm not going to say that
they don't have any.
They do.
Yes.
Impact on lessening that stress on the healthcare system as a whole.
Yes.
But as of, I think yesterday, it's been announced that they can.
They can, yeah, which is amazing. I'm very excited.
And again, there's going to be some bad apples in there. Like I said, I read through what my hairdresser's doing, and I'm like, yes, like you're doing pretty much everything I'm doing. So I already trusted her. I think she's great, and she will always take our best interest in our health into consideration, always. But there will probably be hairdressers out there or stylists out there that won't follow and do what
any directive that they've been given or anything like that. Absolutely. Just like there will be some massage therapists that don't, or already are not,
that don't.
Yes, exactly, right.
So
there will be that. But I think as a society, like, we can kind of keep that under, you know what I mean, control. Like, you notice a place or a person or whatever not doing something they should, like, make sure you're on top of them. I think I saw today, not to call anything out, but I don't know names or anything, but I saw today an RMT heard of another massage therapist who was already telling clients they don't have to wear a mask and just to like keep it on the DL. And there was that whole, like, I'm not going to call them out or anything, but and you know what I mean? But in the back of my head, I was like, is that really what you want to be out there though? Like, maybe you need to go to that therapist, because there's a way for you to contact them and be like, I've been told specifically by clients that you are saying this. That is not okay. Right? Like,
hold each other accountable.
We're self-regulated. We're self-governed, right?
But
we
also,
have the ability to do that for each other. And yes, an RMT can have a problem, be like, don't get in my business. But like, if a client said something to you, they're saying it to you for a reason. Either it's because they're confused as to why you seem to be so much stricter than someone else, or they're concerned that the other RMT's not being strict enough, right? And they don't want to be the whistleblower, but that's up to us, right? Like, that's not on client, that's on us.
That's on
to
us.
Make sure that we're all sticking to the rules. So
yeah, we need to hold each other accountable, but we also need to do it in a respectful way, because I've also read some ways where somebody felt maybe they were holding somebody accountable, but they did it in a very unprofessional way by saying private Facebook messages with some pretty nasty language involved. We're professionals. Let's keep it that way. Again, I'm going to say it again. You want to be seen as a healthcare professional, act like a healthcare professional. Use your professional judgment, use your therapeutic judgment. You know, maybe go and revisit your therapeutic relations. I think that's a whole other podcast for us to dive into at some other point. But hold each other accountable, but do it in a professional way.
Yeah, absolutely. And lean on each other. If you really aren't sure how you're supposed to do something, maybe there's someone who's in a similar situation who has already like run through it or thought about it, and they have some like the advice for you, right? Like, there's nothing wrong with that. I think we've implemented all of the protocols and directives pretty seamlessly.
Yeah, I think so.
Time will tell. I think we're going to do another podcast, like maybe like a week or so, and be like, this is how it's going, what we've changed.
Our first week back, and then maybe we'll do a month back or something.
And yeah, you know what I mean? See how it's changed. But I'm pretty confident that what we're doing is going to be like the best of our ability to keep everyone and ourselves safe, right? Because if we get sick, we can't help anyone, right? There will be risks no matter what. This is a very tricky pandemic. This is a very tricky virus, and that it doesn't show its ugly face for a few weeks. So people could be giving you their best judgment and not know. Everyone, I think, just needs to like take a deep breath and know that we're all going to do our best and just mull it over, right? Like just, we don't need to make any sort of like rash decisions. There's nothing like that that's that important to make. And I'm going to throw this out there. If you go back as a therapist and you realize it's just like too much, like there's absolutely nothing wrong with stopping,
and
right?
taking a break, stepping away,
and taking a break. You know what I mean? Like, I think they just announced that curb's going to be extended, and I don't know all the rules around it because I'm going back and I'm going to be well outside that $1,000 anyway, so I don't even bother reapplying. But if you go back and you realize it's too much, like the risk for you feels too much, like you realize you get in that room and it's overwhelming, like you can make that choice to be like, I'm sorry, like it's too much, and you can shut your doors again. That's okay. You know what I mean? Cold and flu season, not that far away again. So I think that'll be interesting time come this September.
And to echo what you've
October, so
and to echo what you said about leaning on each other, we've kind of mentioned it a few times. If you're a member or not of the RMTAO, go to their website, and I believe under resources, you'll find CBN, community-based networks. Find one in your area. There's a whole bunch of us all over the place. And if there isn't one in your area, I believe Ottawa doesn't have one right now. You can reach out to another group. So you can reach out directly to me, and you can join our group, our Facebook group, and I send out emails and we have virtual talks. You know, reach out to another RMT in your community or reach out to these groups. Again, you don't have to be an RMTAO member to be a part of the group, but there is also, I will say, you know, there is a webinar coming up, an RMTAO webinar, and it is exclusive to members. That is, but being a part of our group isn't. So
So there are people, if you're struggling with like at all, definitely just reach out to someone. It doesn't hurt to do. So I think my biggest worry going back is how scary all the signage looks on our front door. All the big like red and yellow alert attention signs.
It doesn't look as pretty anymore.
No, it doesn't. It feels very aggressive, but I realize I've seen those signs in 100 places, so they're not so bad. I sent them to a friend of mine who's also a client, and I was like, how scary does this look? And she said, it doesn't look too scary. She said, what it looks like is that you're informed and you're doing what you need to do, because we laminated them so we can wipe them down. Do you know what I mean? And all these things. So she's like, it looks like you've taken the time to really make sure you have a handle on the rules and safety. So I was like, okay. As long as it comes off that way and not like you're coming into like a nuclear radioactive zone. Because that's the last thing we kind of want, right? So like you're going to be dealing with a lot of clients like concern and stress about all of this. So I think going back, that's probably what we're going to see a lot of. I think that's going to be more draining than any of the laundry and the paperwork is. For the first like month, just talking about COVID. For the first month, talking about the last 3 months, I think it's going to be the most emotionally exhausting part of all of it. So I'm trying to take this last week and sort of prep myself for all the conversation I'm going to be having with clients and all the reassurance I'm going to be needing to give them, and hoping that I can make them feel, if they're on the edge of coming or not, calming those fears, and still allowing them to know the ability that if they are unsure, that I'm not taking it personally in any way, shape, or form. This is a personal decision to them, and I no way take it personally if they do not feel comfortable coming back. It doesn't phase me at all. So I had that conversation with one client that them not coming back doesn't make me feel like they are questioning my ability to provide safe and ethical care. I understand that they are just in an age group and a risk group that they're not even going to the grocery store. And why would, you know what I mean? If they already don't feel the risk outweighs the benefit, then who am I to tell them that it does? Right? I think that's going to be an interesting point. I think we'll have a lot to say about that after we finally get back. Yes, on our follow-up episode. So I think we've covered everything we wanted to cover. think so.
With today. We'll leave you with that, and we'll kick it over to RMT time. I feel like I need to create
a jingle.
some sort of jingle. If anybody's out there that can create a jingle, please let me know. But anyways, it's RMT time. So what are you drinking over there?
So I am drinking in the beautiful Massage Therapy Podcast mug that Heather made for us. Sunshine Super C Sunshine. It's from David's Tea. It's one of the ones you ordered for us. I don't exactly know because I don't have the bag. I took it into work, but it's essentially just like citrusy delightfulness.
It's Sunny C.
Sunny C. I knew it was something citrus that I don't know. I knew you would know. Yeah, Sunny C. So I think the idea is that it's like vitamin C, and I think it says something about immune boosting. It just tastes delightful. I'm all into like citrus these days. So how about you?
Yes, I'm drinking. You guys are gonna be shocked. Not David's tea today.
Dun, 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 dun.
I'm actually drinking a local tea from Deadly Grounds.
Ooh.
It's I was trying to look it up today because I bought it back in like the fall. What the name of it is, and I don't think they're carrying this one. I think it was just like a seasonal one, but I think it was called Amityville Horror or a play on Amityville Horror in the word tea. And so it's a rooibos with rose hip, almond, and a couple other things. When you smell it, it smells like amaretto.
Oh,
yeah.
Nice.
So it's really nice. And I love it as a tea latte. I'm not drinking it as a latte right now, but it's really good as a latte. Ooh. So a big shout out to Deadly Grounds. If you are in the Durham area, go check them out. I know they're still selling like coffee and tea that you can go pick up, like bags. And like my partner, he loves their coffee. So, and I really like their tea. And that's a weird thing you might not know about me is I weirdly love Halloween, and it shocks people. And as I'm sitting here staring at my skeleton in a yoga position, and it's the middle of June right now.
Yeah.
And that's kind of their whole shtick at Deadly Grounds. So yeah, well, I hope you as our listeners have felt like maybe a little less pressure, a little less stress after this episode, and just take it day by day, do what's best for you and your clientele. That's all we can really say, and assess your risks.
Yep.
All of them. If you haven't done your IPAC, go do your IPAC, and then you'll understand what I'm talking about.
Yes. Start there. Start with those videos. As much as we all hated them, and I think we all disliked the idea of having to do them. It brought forth a lot. It made sense why they made us do them, and I'm glad that they did, as much as I wanted to pull my hair out with the technology glitches that were happening.
Yes.
And the fact, and if you're doing them and you think you're, I don't know, not smart because you have to redo the test 5 times, know that I pretty much did every test 5 times because I was trying to do them while I had a toddler around. And some of the questions were like super confusing sometimes. I don't really know. There's definitely some like, hey Heather, like what's the answer to this one? Because if I have to redo this for a 6th time, I'm probably gonna punch something. Some inanimate object is gonna feel my wrath. Start there, do those, get those out of the way, and then I think you'll be able to clear your head as to like what the rest of the directives sort of are, because they seem like they kind of stemmed from those, right? So yeah.
Thanks for tuning in again.
Yeah, happy getting back to work, everyone.
Yes, good luck, everyone. Thanks for listening to this episode of the Massage Therapy Podcast. We hope you enjoyed it.
If you have any questions, drop us a line on Instagram at the.mtp. You can share this episode with your friends, family, and colleagues by posting a screenshot of the episode to your stories and tag us.
Be sure you are subscribed wherever you listen to your podcast so you can hear more episodes.
If you would like, please leave us a review and comment where you can. We would love to hear from you.
We'll talk to you next time. Be kind, be well.